Okay, I think we'll get started. Good evening, everyone. Thank you so much for joining. My name is Dr. Anand Bhan. Welcome on behalf of Sangat and Essence to our Policymaker Engagement Series. We are continuing our webinar series. As you know, we've done 3 so far. This is our 4th webinar, and we are very excited to have our speaker today, Ms. Mahadevan, who's an IAS officer. She's the Principal Secretary for Panchayat Raj in the Government of Karnataka. Just some background information about the series and also Sangat and Essence as a project. So Sangat is an NGO which has been around for almost 25 years. It's committed to improving health across the lifespan by empowering existing community resources to provide appropriate physical, psychological, and social therapies. The areas of work where we focus on is child development, adolescent and youth health, and mental health and chronic disease. Specifically, the Essence project is a 5-year project funded by the US National Institute of Mental Health, which aims to bridge the gap between science and mental health care services. The project seeks to generate evidence on cost effectiveness, implementation approaches for scaling up evidence-based interventions for mental disorders, specifically for depression. There are 2 components in the project. One is a scale-up component and one is a capacity building component. In the scale-up component, we're actually conducting research in the state of Madhya Pradesh, specifically in Sehor, which is just the neighboring district to Bhopal, the capital, where we're working with the government of Madhya Pradesh, also through an MOU with the National Health Systems Resource Center, where we are developing and evaluating the comparative effectiveness of technology-enabled interventions to train and support non-specialist health workers. In this case, these are ASHA workers to deliver the Healthy Activity Program, which is a brief psychosocial therapy for depression in primary care settings. So pretty much trying to see how community health workers at the forefront of our primary healthcare system can be involved in delivering psychosocial care. The second component is the capacity building component. In this component, we are working with multiple organizations in South Asia. And the aim of this component is to build capacity of researchers, media professionals, policy professionals, program managers, and service user representatives to disseminate mental health research and to enhance the uptake of research findings. And this is being done through fellowships, through online courses, through workshops, and through this policymaker engagement series. So just a few ground rules so that I'm sure many of you have attended these webinars before, but just reiterating those for some of you who might be new. Just make sure that you keep yourself on mute throughout the session, keep your video off. You're welcome to ask questions in the chat window when the speaker is speaking, or if you are following on Facebook Live, then through the comments function. The moderator, who in this webinar series is me, will be collating the questions and asking the speaker on behalf of the participants once she is done with her introductory remarks. Any rude or inappropriate questions will lead to the participant being removed from the webinar. I think we want to keep this webinar space a safe space, so kindly be mindful of that. Also a reminder that the policymakers who are sharing their perspectives in this series are speaking in their individual capacity, and their views might not represent those of the government. For those of you, I know because this has been a request we've been getting over the last couple of webinars, if any of you wants a participation certificate, then kindly reach out to Babita. Her email ID is on this slide, babita.negi@sangat.in, after the webinar. And if you have registered in advance for the webinar, then she would be happy to send you a copy of that e-certificate by email. Finally, just a reminder, we are on the eve of World Mental Health Day. World Mental Health Day is tomorrow. It's observed every year on the 10th of October, with the overall objective of raising awareness of mental health issues around the world and to mobilize efforts in support of mental health. This day offers an opportunity for all stakeholders working on mental health issues to talk about their work, what more needs to be done to make mental health care a reality for people worldwide. And I would add probably quality to that mix as well. So there's a lot happening on our social media channels. You can follow that on, on Facebook, on Instagram, on Twitter, on LinkedIn. And again, the theme for this year's World Mental Health Day is greater investment, greater access. And we hope to see that becoming a reality in the near future. So I will just now maybe transition and introduce our speaker for today. As I said earlier, we are very delighted to have Ms. Uma Mahadevan join us on the eve of World Mental Health Day. Uma is an IAS officer of the 1992 cadre. She's currently a principal secretary in Panchayat Raj in the government of Karnataka. And prior to this, she was working as principal secretary, women and child development, during which time she steered the launch of several important new policy interventions in the state of Karnataka. Most notably, the Matrupurna program for pregnant women and breastfeeding mothers. She has previously worked in the planning, agriculture, education, and health sectors in the state, and also the atomic energy sector in the government of India. She was a member of the working group that produced Karnataka's first human development report, and she's a regular contributor and writes prolifically actually on culture, policy, and development issues. And for those of you on Twitter, you should certainly follow her. Her Twitter ID is Reading Kafka. As I was telling Uma when I was speaking to her yesterday, following some of her tweets on a regular basis are among the highlights for me on many days, because she puts out some really interesting, updates around positive stories from communities and rural areas about how it's possible actually to work with local governments in ensuring nutrition, in ensuring community development for young women, for kids, etc. And it's really nice to see a policymaker being so supportive of that. So Uma, it's an honor to have you. Thank you so much for joining us. We look forward to hearing you. The structure is we will hear you out first, and then we will have a Q&A session. And Uma will be speaking on local governance and mental health, linking up with Convergence at the Frontlines through the work of community workers. So Uma, thank you again, and over to you.
Thank you very much, Anand. It's a great pleasure to be here at this really important initiative. I congratulate Sangat, and I think, Anand, you're a terrific moderator. The previous sessions also must have been very interesting. I look forward to catching up with them. I am particularly happy to be participating and privileged to be participating on the eve of World Mental Health Day. I think it's very important for us to mark these commemorative days with initiatives like this, which focus on the more vulnerable among us and how we can build more resilient and healthier communities, holistically healthier communities in every way. I am currently working as Principal Secretary Panchayat Raj in Karnataka. But this is not the only reason why I chose to speak about local governance and mental health, and about how we can try to achieve convergence at the front lines through the work of community workers. In many of my previous postings, which have mostly been in the social developmental sector, I have had occasion to work, and it's been quite an honor and privilege to work with community workers in Karnataka. Community workers, as we know during COVID, as we've recently seen, are among the most valuable asset in our health system, not only in our health system, but I think in our frontline social welfare system. Community workers like ASHA workers, Anganwadi workers, village rehabilitation workers play a huge role in helping to maintain the health of communities, especially rural communities, who often have little or uneven access to regular healthcare and regular services. And therefore, after joining the Panchayat Raj, Rural Development and Panchayat Raj Department, it seemed to me that there is a greater scope for convergence at the front lines through the work of community workers. And that's what I wanted to talk about today a little bit. I'd like to start by actually showing you a couple of pictures, a few pictures from the field, from my previous posting, which was in the Women and Child Development Department, where I first saw the tremendous work that frontline workers can do to change outcomes for people in difficult situations. Let me just see if I can share the content. Okay. Give me a moment. I'll just have to figure out how to do this. Can you see it?
Yes, we can. Please go ahead.
Okay, great. So this is really the focus of my talk, Convergence at the Frontlines, through the work of community workers. But this convergence, I must say, is not easily able to happen without local governments playing an important part in making it happen. And that's why the two parts of this title, local governance and convergence, in order to bring about mental health in communities. So one of the first pictures, yeah, this is a picture of a mother and child who, an Anganwadi supervisor in my previous posting, when I was Principal Secretary Women and Child, an Anganwadi supervisors have my numbers. They keep sending me pictures or reports about what's happening in the field. They ask me questions. It's one of the great pleasures of the job that one can interact directly with people working at the front lines and doing important basic work, fundamental work in communities. So this was a picture that one of our Anganwadi supervisors sent me because she had gone to track down the health of a severely malnourished child. And when she went home to look at the child and see what was happening and why the child was not coming to the Anganwadi, this is what she found. She found a house where the mother and child had been abandoned by everybody else, but the husband, the family had abandoned her. And this was the condition. I've blocked out the mother's face to protect her privacy. This was the condition of the house. You could see that the mother was in severe distress. She was incapable of caring for herself, let alone for her child. But she was still doing all she could within her circumstances. Not only severe emotional distress, but also clearly economically in a very dire situation. Of course, our supervisor immediately looked at the status of the child and found that the child needed to be bathed and needed to be cared for. And this is what she did to actually help teach the mother how to look after the child, how to bathe the child, how to wash the child, and provided packets of supplementary nutrition. And of course, in this particular case, it was possible to intervene and to bring the mother and child back into the system of care, maternal care, and into the Anganwadi and into regular care. But this got us thinking about what we need to do for the majority of women, pregnant women and breastfeeding mothers, many of whom tend to be malnourished, who tend to be in difficult circumstances, sometimes victims of domestic violence or of other kinds of stress. And what we could do to ensure better outcomes for children especially, but also for mothers who are going through pregnancy itself is a difficult period. And with all the other kinds of difficulties that they face, they really need care and support from communities. So what we did was we looked at the existing supplementary nutrition program, and we started it actually as a supplementary nutrition program, not really as a peer support or counseling kind of program. But we looked at the existing nutrition program and we found that what we were doing was giving take-home dry rations to pregnant women and breastfeeding mothers. Up to 10 lakh women in Karnataka at any given time able to access the take-home rations. Not all of them do, depending on their capacity to, or some of them are in positions where they don't require the rations or don't require the support from the Anganwadis. Some of them are in urban areas where they may be in different locations where Anganwadi services may be uneven. But the majority of pregnant women and breastfeeding mothers are enrolled in the Anganwadis and used to receive take-home rations. But what we found with the take-home rations was that there was a huge problem of either pilferage or of uneven quality, or even if the quality was good and it was not pilfered, it would get shared at home. And even if it wasn't shared, and even if the mother managed to take the rations herself, it never used to meet all her requirements for the month and would get over within a few days. And therefore, what we came up with was the idea of converting it into a hot meal program, which a couple of other states had already done, Telangana and Andhra. And on the same model, we decided to convert it into a hot meal program. So this is the hot meal program, which was called Mathrupurna. And it was, it was initially conceived of as just a meal program because women were not getting sufficient nutrition. Babies were not getting sufficient nutrition during the gestational period. And therefore, we wanted to improve women's nutrition during pregnancy. We wanted to address their anemia. We wanted to address the issue of birth weight among children and so on. Mathrupurna became a daily hot meal program. We were giving 150. It was very scientifically designed by the National Institute of Nutrition. It was, rice and a boiled egg, a glass of milk, a bowl of lentils, pulses, green vegetables, green leafy vegetables, and peanut chicky. So this was, dietary diversity, different forms of protein, enough vegetables, enough micronutrients. But then we decided that, this is a good opportunity to also layer health interventions such as the IFA tablet, the calcium, the deworming for the mother, the tetanus injection, and some nutrition education and counseling about early childhood stimulation. So this started, and this was a very, very successfully launched. It was launched in it was first piloted in 4 taluks, and later it was launched on the 2nd of October in 2018, very successfully in the whole of Karnataka. Women started coming to the Anganwadi. People would ask us questions, are they really going to be able to come to the Anganwadi? They're pregnant. We had to explain to people that pregnancy is not a disease, it's a condition which is perfectly normal, and women can actually enjoy the experience of walking up to the Anganwadi. But why I'm showing this picture today is because one of the unintended and very fortunate and happy consequences of this was something that the director of NIMHANS had told me, that this program that you're going to do is going to help reduce the postpartum blues of women as well. And it was surprising to me because we started observing when women came to the Anganwadi first, they would have all sorts of superstitions about how, because we have even gender biases against gender prejudices against women eating. Pregnant women eating is itself a fraught issue in many of our cultures. And so women would sit facing the wall because they thought that the evil eye would fall on them and things like that. Initially, within 2 or 3 days, they felt so silly and laughed about it and started facing each other and eating together. And here is a picture in a tribal taluk in Mysore of women sitting together and eating together. And this is why I'm showing this picture, because what we discovered was that for the women, it was not only their own me time, it was their time with friends, and they were forming informal social networks. And I'm happy to say that an impact evaluation, which was conducted of the program, later showed that not only was the maternal anemia reduced and there were benefits for the children's birth weight and head circumference, but also the women's mental health condition on a scale, Edinburgh postnatal depression scale, for women who attended the meal program for at least 75 days or more, was actually impacted beneficially. So here was a program which was designed by us in detailed consultation with field workers, with experts, with the doctors, with nutritionists, and so on, but also after talking to women. And we also spoke to the families, we spoke to husbands, we spoke to the mothers-in-law or the mothers. Everybody else, other than the women themselves, everybody else felt apprehensive and wasn't sure whether this would work. But for the women, the program worked brilliantly, because they were able to come out of their house for 45 minutes or an hour, meet with their friends, spend some time, form informal social network, walk in the sun a little bit, chat with their friends. And this became a great place for them to catch up. This was one of the happy outcomes. I'm sharing this because this is one of the kinds of interventions that local governments can strengthen and can ensure to improve mental health of women during the period of maternal of pregnancy and so on. And this is a program which shows how informal social networks help to improve the sense of well-being of women at a time when they're already under some stress. I'd like to start the discussion with a mention of the legal provisions of the Karnataka, in Karnataka itself, but also in other states. Karnataka Gram Swaraj and Panchayat Raj Act. This is our legislation, which was brought in 1993. But Karnataka has a history of very progressive work in decentralization, and its act in section 58 very clearly mentions that the panchayat, the Gram Panchayat, also has the ability to make provisions for carrying out any measures which are likely to promote the health, safety, education, etc. of the inhabitants of the panchayat area. It also has the ability to promote programs and the responsibility to promote programs for de-addiction and family counseling within the panchayat area, and also shall make provisions for carrying out any other programs and take measures to promote the health of inhabitants and for protection of the environment. Now, what does this actually mean in practical terms? How many panchayats are there, for example? Karnataka, being a large state, has around 6,010 exactly, to be precise, 6,010 gram panchayats. Each gram panchayat caters to a population of roughly 6,000 to 8,000 persons. Now, 6,000 to 8,000 persons is a perfectly feasible population for whom one can really plan for good outcomes and for promoting the health and safety and well-being of those who are in vulnerable situations. So some of the things that I'm going to talk about, what local governments, by local governments, I'm really talking about Gram Panchayats, but at a different level, Taluk Panchayats and Zilla Panchayats also can, within, within their parameters and their jurisdiction, can take up similar programs. So local governments, panchayats, can promote physical, mental, and emotional well-being. How can they do that? Most importantly, by giving kids a good start in life, because they can help develop mental well-being and resilience from birth for children. This is an important thing, because if you just take the example of Anganwadis, we have 66,000 Anganwadis in the state of Karnataka. Now, 66,000 Anganwadis means if you have 6,000 panchayats, you roughly have 5 or 6. There are some which are urban Anganwadis, but otherwise you roughly have 5 or 6, all the way up to 6 to 10 Anganwadis in a panchayat area. Now, in every Anganwadi, if you have around 20 to 25 children, you can certainly plan for good outcomes for those children, ensure that their mothers, ensure that pregnant women who are registered are getting their meals, are well cared for, and are provided antenatal care, antenatal checkups, and that children, once they're born, are promoting breastfeeding within for the first 6 months by the mothers, and thereafter getting their take-home rations, their milk powder, their eggs once they're 3 years old, basically giving kids a good start in life. This is an important, this is possibly the biggest intervention which will yield to long-term societal benefits. But panchayats can also, and preventive societal benefits, but panchayats can also, in the case of mental health, and not only in early childhood, but through the course of life, they can adopt a holistic and convergent approach. Convergence, why do I keep repeating the word convergence? Because convergence is something that we talk about a lot in government, but it's very, very hard to achieve. It's very elusive. Where it actually can happen and where it magically happens is at the front lines, because that is where the programs, the cutting edge of programs, the implementation of programs, where the Asha, Anganwadi worker, the supervisor, the ANM, where they talk to each other and they say that, yes, in this panchayat we shall, and the Gram Panchayat president, the vice president, the members, the panchayat staff, the self-help group women, if they come together as a community, as a local government, they can bring about a holistic approach with convergence for the promotion of mental health, for the prevention and treatment of mental illness, and solving issues of stigma, discrimination, and rehabilitation and recovery. Now, how can they do this? This is actually a large task to expect local governments to do. But I really think that in some ways, this is something that only local governments can do, a part of this, because building resilient communities means that you need local governments to build that sense of community. What else can they do? They can address the impact of, now, physical environment. This is something that we don't think about enough, I think, but the impact of the physical environment on mental health, not only in homes, as we know, during COVID, it's extremely stressful to be housebound, to be locked into, into your house with everybody trying to take up the space, both physical and bandwidth, and so on. The burden of care coming disproportionately on women, as we've already been seeing in reports and in analysis, but also homes of especially vulnerable groups, but also in settings like schools, hostels, public parks, water bodies in the panchayat area. This has a tremendous potential to improve the sense of well-being if done correct. And most importantly, panchayats can disseminate awareness to equip people with information and resources and knowledge for self-care and good mental health. Why do I say this, and why do I, why do I expect that panchayats can deliver on so much of this? Because we have seen during COVID, and I'd just like to share this, during COVID in Karnataka, what we did was, in March itself, the moment the pandemic was declared and declared as a disaster, we in Karnataka set up, issued orders, guidelines, setting up panchayat task forces, COVID task forces in every panchayat. So we had 6,010 COVID task forces, and in every village, so 27,000 villages, each had a village task force with volunteers, with panchayat members, with panchayat staff, but also all the frontline workers, including the Asha worker, the Anganwadi worker, the village rehabilitation worker, but also the police, representative of the police, and the village accountant or the representative of the revenue department. And as special invitees, we also had the local bank manager or the banking business correspondent, the representative of the bankers. What they did was, and the teachers, the school teachers, all were members. What they did was, they were tasked with 4 things. They were tasked with, 1, science-based dissemination, because we were very afraid and apprehensive that WhatsApp and misinformation should not create problems in rural areas because of the information asymmetry. So the first role was science-based information dissemination about the virus, about what were the precautions to be taken, and how people needed to protect themselves and their families and their communities by adopting the principles of hand washing, proper hand washing, and physical distancing and so on. So this was one part of it. House to house dissemination. Now, this is not something that state departments can do. State departments during a lockdown were not even able to go into the field in many places, but that during that vacuum, the local governments played a huge role in doing science-based house-to-house dissemination, as well as dissemination through traditional methods like beating the drum, making announcements, sending an auto rickshaw with a loudspeaker around to every street to tell people what the virus was all about, how they should protect themselves, so that misinformation was prevented. The second thing they did was to ensure essential supplies during the lockdown so that nobody was in difficulty. Along with that, they also looked after migrants who needed help, who needed shelter, who needed relief, community kitchens. They also ensured meal supplementation and nutrition supplementation during the time of Anganwadi and school closures, even now being done by the Gram Panchayat task forces through either distribution at the Anganwadi or the school to the parents who come and pick up the take-home rations, or distribution doorstep delivery to their homes. And importantly, looking after the vulnerable. A house-to-house survey of all the vulnerable, the elderly, the pregnant, the breastfeeding mothers, those with comorbidities like diabetes, hypertension, severely immunocompromised in for whatever reason, those with kidney illness or cancer, were all identified. And their list is with the panchayats. The panchayats have set up help desks and call centers through which outbound calls go to houses, asking whether people are having any difficulty, if they need any help, if they need any support. Now, this is something where panchayats have shown tremendous innovation and initiative. They have played an important part in running institutional quarantines, in monitoring home quarantines. More than 1 lakh people have been monitored in institutional quarantines through 12,800 institutional quarantine centers. This is tremendous work by the panchayats, and this shows us that they have the capacity, not only during a pandemic, but throughout the year, to care for the most vulnerable, not only the responsibility, but also the capacity to care for those who are in their communities the most vulnerable. And this is something where if we orient them and sensitize them, I think great things can be really made possible. This is something where we really need to look for ways in which we can use, because we have, with 6,000 panchayats, we have something like 1 lakh, almost 1 lakh elected representatives who are really local leaders of the people, whose voice people listen to, who, if we can orient them, and I'll come to that, I've already been discussing with Anant, and I hope to take this discussion forward, because once we have our panchayat elections, we want to have a module on mental health and on orienting the panchayat representatives, elected representatives, about how they can promote mental health in their communities. I'd like to, so that's an area of great potential. I'd like to talk a little bit about the social determinants. I'm sure all of you are much more aware than me of how mental health is affected by social, economic, and physical environment and the social determinants of mental health. We do know that experiencing deprivation and adversity increases the risk of mental health problems. And we also know that experiencing mental health problems increases a person's vulnerability to deprivation, because they get stigmatized, they get abandoned, they may lose care. Along with that, complex issues of loss of livelihood, shelter, family relationships, when families stigmatize or abandon the person, and the experience of stigma itself can compound the mental health problems faced by an individual. Also, social isolation. I think this is something where we again need to emphasize to panchayats their role and their responsibility in reducing the social isolation, even among those who are otherwise economically stable or have shelter or have a livelihood. But social isolation is one thing where panchayats can play a role, especially among the elderly. I'll come back to that. Among the elderly, among those who have been abandoned, or those who are seasonal migrants, and so on. Social inequalities are associated. We live in a very unequal society. There's increasing discussion about inequality all over the world. And the social inequalities that we see, especially at a time like this, at the time of the pandemic, at the time when livelihoods are under stress, at a time when in some parts of the country there have been floods which have further exacerbated inequalities, or people's difficult situation caused difficulties. Inequalities are associated with increased risk of disorders, and the prevalence, of course, varies across social groups. Exclusion is something I'd like to talk about, because as someone who's worked on social welfare programs and in social protection, I have seen that those who are excluded typically from social welfare programs such as the ICDS, which is the Anganwadi programs or the Anganwadi services, or maternity benefits like the cash transfer programs, the Matru Vandana program or the erstwhile Matrushri program, or different kinds of Janani Suraksha program, and also school education. Who are those who are excluded? Those who are excluded are the ones we have to look at those and look for those who are excluded from the programs. They tend to be those who are either seasonal or circular migrants, those who work, for example, in sugarcane harvesting. Migration happens for 3 or 4 months at a time. It happens with young children in tow. Entire families come. They work in, say, one set of fields for about a month, and then they move to another place. So every month they're shifting across 3 or 4 months and then going back. This is very, very likely to be a group which is excluded from most programs. Brick workers. Again, brick workers are those who, brick workers typically migrate after the rainy season and migrate to different states, not their own state. So they also have a problem of language, but they migrate for 6 to 9 months and typically again migrate with children. And brick workers again are typically working in jodis, where the husband works with the wife. They work on piecework, and the wife, being a woman and being part of a jodi, is many times not even recognized as a formal worker in the register of the unit, and most times the payment is also done directly to the men. So there are lots of problems. Poultry farm workers, again, piecework, not piecework, but work which goes through the day. So entire families migrate to do poultry farm work. Nomadic and semi-nomadic groups, child laborers, sex workers, I could go on, transgender persons in different, those who've been abandoned or thrown out of their houses. This list could go on, former Devadasis. So these tend to be the most vulnerable, the very elderly who have dementia or associated problems. These tend to be those who are excluded from different programs, social welfare programs or social protection. And this is a place, again, where the panchayats, more than anything else, can really play more than any other institution. It's the panchayats, because the numbers are reasonable, they are within the community, and they know exactly who is left out of what. And if we can institutionalize and put in place a systematic approach to include those who have been excluded, that could play a huge part in reducing feelings of stress and anxiety among the most vulnerable of our communities. So a holistic approach. How can panchayats take up a holistic approach? They need to promote. The first thing is that they need to promote a sense of trust and connectedness within the families, within their communities. And how do they do this? By supporting people. Panchayats need to take a life cycle approach, supporting people transitioning into different life stages, including before birth, women who are pregnant, ensuring that they're cared for, ensuring that there's a system by which their antenatal checkups happen regularly, ensuring that if they have any stress or if there's any domestic stress or livelihood stress, there is some protection provided or some support provided from the panchayat. Maternal and child health programs, inclusion into maternal and child health programs. That itself is a tremendous form of support. The Anganwadi programs, Anganwadis provide 6 services, including immunization, supplementary nutrition, maternal nutrition, so on and so forth. School education. We I think underestimate, I know I have underestimated the importance of school in, it's only recently, in recent years that I've realized the importance of school in promoting a sense of well-being and security among many of our children, and especially our young people. Hostels, residential hostels, again, children are away from their families. Karnataka itself has something like 6,000 hostels, pre-metric, post-metric hostels. Young people are away from their families. They need to be provided support and provided stress so that their mental health and well-being is promoted. Young people transitioning again into secondary education, the kinds of fears or anxieties or stress that they may be undergoing. Maybe there's a change in the medium of instruction. These are kinds of things where an orientation and support, orientation before the transition and support during the transition and a little into the transition. These things can be very helpful, very useful for people undergoing this kind of stress or anxiety. And this is something where panchayats are very well placed. Livelihood programs, Mahatma Gandhi Narega is typically meant for this, nothing but Mahatma Gandhi Narega, livelihood programs, and also women's self-help group programs like the Rural Livelihood Mission. And older ages, supporting the elderly is something that panchayats really need to do. Kerala has been doing it in a very systematic and very rich way, caring for the elderly, caring for those who need palliative care. This is something that some of our Karnataka panchayats in some districts have started recently, and we're very happy to say that this is something we plan to support in months to come. I think middle and high school is a place where children undergo different kinds of the stress and the changes that are happening to them as they enter preteen and teenage years. And this is an area where tremendous research has also shown tremendous benefits can be gained by talking to girls and boys in their classrooms and outside their classrooms about gender equality, about sensitization, about adolescent changes. These are things that can be easily done, can be packaged into modules, and can be done in a very sympathetic and sensitive way with the young people in schools, and can prepare them for the stresses of the future. Because we know that our young people, given the fierce competition for exams and seats in colleges and so on and so forth, young people tend to be under tremendous stress as the exam years come closer. And this is something where panchayats can play a very important role in not only in talking about gender equality and sensitization, but also about providing basic life skills, providing basic coping skills and resilience to young people. They can also, as I said, promote the formation of informal social networks like the Matrupurna groups, which I showed you, the women's lunch groups, the pregnant women, the breastfeeding mothers. I remember talking to a Gram Panchayat Adhyaksha in one of the districts. She was a woman Adhyaksha, and I asked her, what do you think about the Matrupurna program? She said, I think it's tremendous. I said, are you just saying that because I'm the principal secretary and you want to say something nice to make me happy? She said, no, you know what happens? She told me, she said, you know what happens? Here are these women, if they're inside their houses because of cultural norms and so on during pregnancy and after pregnancy, after delivery, after childbirth, they are always under somebody's control, either the husband's control or the mother-in-law or the in-laws or her own mother, elders of the house and so on. But here she's able to come out of the house every day for half an hour, 45 minutes. It's her own time. This is her time when she can laugh, she can be with her friends, and it actually relaxes her, reduces her stress. She sees that others are going through the same kind of thing, and it's her time. So informal social networks, I think, is something that needs to be promoted. Formal networks, of course, collectivization through livelihood opportunities like the women's self-help groups is something that the government is already promoting in the National Rural Livelihood Mission and similar such programs. I think those should not be underestimated. They have tremendous potential, not only to smoothen out the effects. A group of women, 15 or 20 women, meeting regularly every week or every 10 days, not only circulating a small revolving fund, not only borrowing from that whenever they need something, some little emergency that might otherwise have catastrophic consequences. We talk about catastrophic medical expenditure, for example. Somebody is just at the, just above the poverty line, but somebody breaks a leg, there's a fracture, there's some illness, there's an accident, and there's catastrophic. So preventing such, such slides back into poverty, women's self-help groups rotate their revolving fund and can actually help smoothen out the effects of poverty, but also I think have tremendous potential to reap the benefits of collectivization, to protect each other, to talk to each other when in distress or in situation of domestic violence, vent a little if necessary, and if necessary, find even greater support and sources of support when required. And I think panchayats can also, this is what I said about the elderly or the destitute or those living alone who need help. We have a system in Karnataka where the police station, the local police station has a register of all the elderly who live alone. And the beat constable usually includes one regular visit every few days to just check on them, or includes it on his regular beat. But I think the panchayats can also find ways of promoting active aging groups or interaction visits, or finding ways to bring the elderly out of social isolation and into community life and community interaction. One of the ways to do this is shared local public spaces. I really think it's time for a state like Karnataka, for example, and for states which have the ability and the orientation to start working on shared local public spaces. We have been talking about housing, we have been talking about providing school enrollment, housing, and so on. But we I think, need to also invest in shared local public spaces, which can be like libraries or parks or playgrounds, not only because green spaces reduce stress and anxiety, but also because I went to Chikballapur the other day, about a month back. I have been on leave recently because I was myself under treatment for COVID. But when I went to Chikballapur, I saw in one of the villages near the primary health center, a beautiful public park has been designed and created through the Mahatma Gandhi Narega, right next to the primary health center, because they said so many women come, so many pregnant women come for checkups, they have to wait, they can, or people come for tests, they wait for results, the elderly come. While they're waiting, they can spend some time in the park, they can take a walk, they can have a little picnic lunch, they can sit here. It was a beautiful thought. And this is something that every panchayat can do, perhaps every village can do, because the Mahatma Gandhi Narega program itself provides tremendous potential to create this kind of infrastructure. These are sustainable assets. It also provides space for intergenerational interactions between the elderly and the very young, between those with also those with disabilities, people who are walking, people who are just sitting there reading a newspaper, reduces feelings of isolation, not only through physical activity, but also the health benefits of being in a very calm and green space and being with others. We know those benefits. Libraries, this is something I feel very strongly about. Libraries are social infrastructure. Happy to say we have 5,600 libraries, in rural libraries in Karnataka, which are with the panchayats. We're now taking up a huge drive to improve these libraries, because they can provide space for so many things, for reading, for reflection, the reading room. Just elderly people going to the reading room every day to read the newspaper, talking to each other for a few minutes, sitting outside on the bench with a newspaper, reflecting, access to information, preparation for exams, all this lowers the stress for young people, and information about employment opportunities. This is something that is preventive care infrastructure, according to me. And this is something that we should really promote. Through panchayats. Housing, of course, shelter for all, safe, accessible housing, but also integrating diverse groups, making layouts not of one particular caste or one particular kind of people, but also including the vulnerable, for example, the transgender persons or the sanitary workers or the sex workers into common layouts, so that layouts become more inclusive and more diverse, and providing community toilets in areas. Despite the difficulties of individual toilets, community toilets are still possible, providing community toilets in areas where required. This is something that panchayats are well placed to do, because panchayats have the responsibility of providing housing. The sense of community. And I think this is one important next step for panchayats which have worked on the previous elements. There's also a need for a sense of belonging. I belong not just to India, or not just to Karnataka, and not just to Bangalore, but I also belong to my neighborhood. I belong to my panchayat. This is my panchayat. This is my first port of call, where I go when I need something. But this is also the identity that I have when I have a community organization, like a sports club or a women's group. This is the women's group from XYZ Panchayat, or this is a senior citizens active aging group. So I think connectedness, community organizations, activities, these are already happening. None of the things that I'm saying are anything new, because these are already happening in isolated places, in places where panchayats have the enthusiasm and the innovativeness to do this, and it's only a matter of scaling up. But also, I think more formally, including the right to participate, focusing on the right to participation. Everybody, including those with mental illness, has the right to participate in Gram Sabhas, Ward Sabhas, which are the village assemblies, which are the formal ways through which the voices of citizens are taken into consideration by the panchayat while formulating its plans and taking out its programs. And finally, of course, the local heritage, if there's some kind of activity, improving local. Ramnagara district, for example, is taking up a set of huge program of reviving kalyanis, which are the old water bodies, water structures, water conservation structures, in every panchayat through Mahatma Gandhi Narega. And that creates a huge sense of identity, because when you're discovering, literally excavating something in your own panchayat, it adds to the sense of pride and to the sense of community. And these are all things that panchayats are well placed to do. This is basically my last slide. For healthy communities, the Gram Panchayat has a vital role in addressing poverty, social isolation, and stigma. Also in improving treatment through early intervention, whether it's in young people or in married women or in the elderly or whoever it may be, in formulating ways for peer support. Because treatment, specialized treatment, is only one part of the equation. Peer support within the community is extremely important for proper rehabilitation. Panchayats in Kerala, many panchayats in Kerala have even started thinking about ways to provide halfway homes for rehabilitation, to reintegrate people after treatment into communities, and basically for care. Care is not something that only the very ill need. All of us need care at different points in our life, and caring for their communities is the primary role of panchayats, and this is something that they're very well placed to do. This is basically my presentation. I'll stop here. I noticed that a number of questions have already started coming in. Thank you for listening. Back to you, Anand.
Yes, thank you so much, Uma. That was quite an explainer. I think, it brings together your many years of working across departments and your perspectives around how we can work with communities. And that, often I presume in public health, there is this feeling that things have to be done from the top-down perspective. And I think you've shown that, how if communities can work on supporting each other, and if you can support that or catalyze that, then there's a lot which can happen at local levels, and there are now probably mechanisms to enable that through the various schemes which are there. It's just putting it all together. So it was really interesting to hear how you think that can happen and how you've seen that happen. Very, very insightful examples. So maybe delving very quickly into the question session. We have around I think 36 minutes remaining now. One of the things you talked about was the right to participate and how this should not be restricted to a particular caste, class, religion, social type within local communities as well. And then you alluded to the fact that obviously it should also include people who might have mental illnesses. But it's one thing to say on paper, say, yes, they should be a part of these kinds of meetings. But how do you actually make that happen? How do you address the stigma issue, the exclusion issue, and ensure that they meaningfully participate? So any thoughts on that?
Yeah, thanks. That's a great question to start with. I think, stigma is something that we have seen during COVID, that if we address it frontally and we talk to those, in Karnataka, we took the approach that, we are fighting against the disease. We're not fighting against those who have been infected with COVID. Rogada viruddha, not rogi viruddha, is what we took right from the start. And that message, that strong messaging to panchayats and orienting them, taking them on board, can play a huge role in reducing the stigma. Again, but not just stopping at orienting the panchayat representatives themselves, thereafter taking that message to communities to reduce stigma. Initially in Gram Sabhas, for example, I think one should do one should formally and procedurally actually have ticking boxes that are these is this category of people included, is this category, is everybody included? But once we do that 2 or 3 times, it becomes a kind of a process. It becomes a natural process, and it starts happening. We did that with children's Gram Sabhas. We did that with women's Gram Sabhas, where we said that not only one kind of women should come, but women from every group, women from all categories should all be invited and should all have the opportunity of participating should they wish to participate. And we will organize the space which is large enough. Of course, during COVID, organizing Gram Sabhas is a difficult enterprise, but hopefully we shall see the end of COVID at some point. And I think starting by including those with every kind of disability or every kind of vulnerable group in Gram Sabhas is a great way to make, not only to make Gram Sabhas more inclusive and to get a multiplicity of voices and perspectives, but also to sensitize just through visibility and presence and participation, to sensitize communities. It's doable, but it's an ongoing process. It doesn't happen overnight.
Agree. And maybe linked to that, we all, I think, have been quite concerned about the way some recent events have panned out. Hathras is an example. So, caste differentials can be a major issue. There are multiple other differentials, social differentials, especially in rural communities, and they operate in many ways. Part of that is as an implication on violence and the kind of violence which happens at the local level, but also linking to probably mental health beyond violence in terms of anxiety, stress, and other contributors. So how does a governance mechanism address that? We can have all the laws that we want, but the reality of rural India can be quite dire for some communities. So any thoughts on that?
So there are several mechanisms to ensure that Gram Sabhas don't. I'll use the example of the Gram Sabha itself, because that's a great platform for convening many voices. To ensure that the Gram Sabha doesn't miss out on the voices of many people. The reality of rural India, as you said, is that different communities live in different places, and very often the poorest tend to live furthest away from the center of the Gram Panchayat or the central village. So we also have in our act a system of having ward sabhas and habitation sabhas. So if a Lambani Tanda is very far away from the main village, you actually go, and if the Lambani residents are unwilling, reluctant to come to the main Gram Sabha because they don't have the faith. Let's assume they don't have the faith, or they're apprehensive that their voices will be heard. So you go to the Lambani Tanda and you conduct the habitation sabha there. So there are mechanisms, and I think local governments should be encouraged to be proactive about including different voices. There is also, of course, there are apart from mechanisms such as this, there is also the a simple act of reserving a part of, for example, 5% of all development expenditure of the development budgets of panchayats is reserved for the welfare of persons with disabilities. Then we have issued very, very detailed guidelines this year. We developed those guidelines. If you look at just the Finance Commission grants, Karnataka's panchayats get around 3,200 crores this year, have got this year, 3,200 crores. 5% of that is around 160 crores. And 160 crores across the panchayats can enable, I'm using the example of disability, but similar examples can be found, can enable the provision of accessible features in public buildings, accessible toilets, and ensure that that is done once and for all, instead of continuously kind of trying to review and say, please do this and so on. Ensure that with these guidelines, the ramps, the toilets, the railings, the required infrastructure to provide basic accessibility features should be done. So these kind of things, again, for caste, there's a 25% reservation of budgets for the welfare of the SC and ST groups. So similar kinds of mechanisms, policy interventions, mechanisms and guidelines can be developed. But of course, I would say that in the long run, there's nothing to beat very proactive modeling of good governance and encouraging, sensitizing, continuously working with elected representatives at the local government level to make visible to them all of their constituents who have hitherto been perhaps not visible. That's an ongoing thing.
Sure, thank you. So, one of the set of questions we've got in advance of the webinar when people registered was around the issue of farmer distress and suicides. Now, I know that that's also an issue in parts of Karnataka, especially North Karnataka. So the query is, what kind of community structures could be helpful to intervene in addressing farmer distress and suicide and creating spaces for dialogue? And also because we know most of these suicides tend to be male, how could we intervene, and what kind of community structures exist where, which could address men as their primary focus, even though obviously the implications are for the entire family?
Yes. Yes, again, I think here again, of course, the district mental health program plays an important role in providing actual professional counseling and treatment for those who are in need. But along with that, I think here again, panchayats and local governments play an important role in providing convergence of different kinds of measures, ensuring that seeds are provided in time, ensuring that fertilizers provided, if there's water conservation structures. I have an example of a place in Bellary where one of the taluks where repeated migration would happen every year over the years. And I was talking to some of the officers who have worked there in Bellary in the recent years, and they were telling me that every year, by taking up a very planned program of creating water conservation structures and creating bunding and improving the land of small and marginal farmers using Mahatma Gandhi Narega, they have actually been able to reduce the level of migration. And now people are actually farming. This year, of course, we've had a good monsoon, so that has added to the benefits. So I think on-ground resilience depends not only on reaching out to those who are vulnerable or in distress and providing the kind of psychosocial counseling, creating mechanisms for that where required, and providing, bank linkage or different kinds of support through the cooperative banks, for example, or the local cooperative society, but also in helping people to improve whatever assets they have and understand the factors causing their stress and respond to those, and maybe uh, help them reduce those factors, reduce those stress factors in some ways. Um, uh, of course, in cases of farmer suicide, where suicides have already, unfortunately, where some of the farmers have already died by suicide, unfortunately, Karnataka has taken up many supportive and rehabilitative measures for the families, including providing for the spouses. They most often are women, providing priority in appointment as Anganwadi workers, or in different kinds of local positions, depending on their ability. And of course, in providing priority in residential schools, admission to residential schools for the children, providing some social protection later.
Sure, thank you. One of the things I found fascinating when you were sharing was you mentioned that you have this kind of an open communication channel with frontline workers, and that you receive regular updates, photographs, etc. from them. How can we accentuate that kind of a feedback loop where frontline workers feel comfortable of being able to reach, top policymakers at the local, district, state level, and perhaps even national level, in a way that their voices are heard, and you are not hearing a modulated set of voices which have been filtered through multiple levels, but that you're actually hearing what is happening on the ground. And how do you create that comfort level?
Right. So this is where technology has been very, very helpful to us. I love having face-to-face meetings when I travel to districts with field workers, with frontline workers, and I like listening to their stories, interacting with them. But technology has been very helpful in allowing us through WhatsApp, but also not only WhatsApp, one-on-one WhatsApps, but within districts we have WhatsApp groups for quick communication. We also have additional different WhatsApp groups only for photographs, so that photographs keep coming in with captions. We have in Panchayat Raj have actually created a Telegram group, which allows for large participation, where we have all 6,000 panchayats on a Telegram group, where all the way from the panchayat officer, panchayat development officer, and the other panchayat staff, all the way up to the two principal secretaries in the department. Everybody's on that panchayat, on that Telegram group, and we get a series of conversations about various issues relevant to the panchayat, or their problems, or clarifications that they require. And the interesting thing there, and which is again a very fortunate and very, very nice development that I've observed, is that that group has started becoming, because as principal secretaries, my other counterpart, the principal secretary, we're not always able to respond very quickly to issues, and sometimes we miss messages and so on and so forth, because there are in a day there can be hundreds of messages, but what they do is they're not only addressing us. In fact, they're rarely addressing us. They're conversing among themselves. It becomes like a peer learning group. So somebody asks, how do I do this? Do you have any instructions? Do you have any this thing? So they help each other. They also support each other. Sometimes one or two cases where we have unfortunately lost staff due to COVID. We express our condolences on the group. We share our difficulties, and that actually is again a very interesting and very active support group, both in the form of information as well as in the form of because working in government in very, very frontline, we call it frontline positions, but especially during a pandemic, more so than anything else, it can be very lonely and it can be very difficult. And therefore, I think that Telegram group has played an important role in allowing them to converse with each other and to express their, stress or their aspirations or their anxieties.
Great, very useful. So, you might have seen that the National Human Rights Commission of India just came out with an advisory on the rights of women specifically with regards to COVID-19. And in that advisory, there's a specific section which deals with frontline workers, ASHAs, Anganwadi workers, sanitation workers who are women. And it talks about the fact that one of the things states and UTs need to do is to ensure fair pay, and that the minimum you are meeting is the minimum wage standards for those local contexts. But they also talk about safe environment, so protection from stigma, violence, discrimination, sexual harassment, and we know all of these are issues. And and because many times these frontline workers are women, they also might face violence, discrimination. They might not be respected, etc. At the local community level. The local panchayat leadership might speak to them, speak over them, and might not give them enough respect, etc. So how are these issues to be addressed, and what has been your experience in trying to deal with those kinds of scenarios?
Yeah, thanks for raising this. This is something that I had forgotten to mention during my presentation. But one of the wonderful experiences that we had during COVID was really about this. Prior to COVID, when when things were, what should one say? Prior to COVID is like BC and AD kind of. But before COVID happened, frontline workers like the Ashas and Anganwadis kept a kind of a healthy distance away from the panchayats, because they felt that the panchayats are elected bodies and they are political. They're actually not political. Karnataka panchayats don't have political affiliations, formal political affiliations, but they are elected, and the Anganwadi workers and Asha workers did not really work closely with the panchayats at all. But once COVID came along, and once the task forces were formed, what we found was that when ASHA workers and Anganwadi workers had to go house to house to survey the vulnerable, those with comorbidities, understand this thing, they were not sent alone. Panchayat staff and panchayat elected representatives walked with them, almost in all the places, because many people still were afraid that ASHA workers or health workers coming to their houses would itself, whether that itself would be a form of transmission of the virus. But the panchayat elected representatives walked with them house to house, and this actually reduced that feeling of distance between frontline workers and the panchayats. And I think that's a tremendous step forward. It's actually a big, big step forward for Karnataka panchayats, because that again not only provides a feeling of support to frontline workers who work in vulnerable situations and who face difficulties, but also that they will continue to have this close working relationship even after COVID. I should also say that in many, many, many panchayats, Anganwadi workers and Asha workers have been honored and felicitated by the panchayat for the tremendous work that they've been doing. Because, the issue of fair pay and so on is a very vexed and fraught issue. These are ICDS and the ASHA program and so on. These are all, Government of India programs, and there are so many other issues that need to be taken into consideration while talking, including financial resources of states and of the nation while talking about this thing. But within the panchayats, what they've been able to do, and I'm happy to say that our orders, guidelines very clearly said that all frontline workers, not only the elected panchayat staff and elected representative panchayat staff, but all frontline workers, all members of the task force must be provided with masks and protective equipment, sanitizers, so on, as required. And the second thing was that as I said, panchayats have felicitated Anganwadi and Asha workers everywhere, not only with, in Karnataka, we have a little tradition of a little shawl and a small little turban and flowers and fruit, but also with essential, essential rations, bags of rations. So panchayats have shown their love and their appreciation in many ways. And they are very, very protective of their ASHA workers. In some places, they've showered petals and so on, all of which is symbolic, but I think symbols also important because they provide a sense of support. In the very few cases, I won't say there have not been any cases of difficulties. In the very few cases where there have been difficulties and where ASHAs or Anganwadi workers or any other especially predominantly women workers have faced difficulties, panchayats have swung into action and prevented the stigma and gone and resensitized people in those areas, in those neighborhoods, about the importance of the work that they're doing and about the importance of respecting and allowing them to do their work. So panchayats actually are even now taking up testing, antigen testing as well as PCR swab collection in many places, which is a huge, huge step forward. In the months since March, they have really gone forward and started, people also have started coming forward and cooperating in a much better way.
Great. So there's a couple of set of questions which revolve around, what role can local educational institutions and also actually the panchayats play in promoting the mental health and well-being of young children, of adolescents, given that they are more prone to self-harm, depression, anxiety, etc. And what can be done about that?
Yes, a great question. We have just set up because having first addressed the problem of managing institutional quarantines and home quarantine and the migrant relief and so on, and COVID care centers, we realized that the next thing that we needed to do through the panchayats was to set up a Gram Panchayat education task force to address the problems, not only about connecting children to reading and learning, for which we are doing the library initiative and making children free of cost members of the libraries, but also to address the anxieties of children, especially those who, for example, don't have a television in their house or don't have a space to study or don't have learning resources. So the panchayat will take care of this. In this effort, we have already planned to link with all local educational institutions which come forward, with all experts or retired teachers, retired social workers who can come forward, and with local foundations, NGOs, civil society organizations, because a large part of actually organizing these so the panchayat will find these spaces, open, well-ventilated spaces, where little neighborhood learning centers, I won't call them schools, neighborhood learning centers with social distancing, can allow children, especially those children who don't have space within their homes or don't have television in their homes to follow the lessons which are screened every day. And the panchayat itself is supposed to provide either a hired TV or a procured television set so that children don't miss out on their learning. Again, the intention is not to to stress children out with focus on learning, but to give them a very constructive set of activities and to reduce their feelings of anxiety and stress at this time, because they may be under stress that they're missing out on school or they're missing out on learning or missing out on online classes. We don't want them to feel that. So we've just created this. And as I already mentioned, I think this is something where we again want to see not only during COVID, for this informal learning, but also post-COVID, we want to carry on this relationship with local civil society organizations, educational institutions, and so on, so that young people and children are counseled about life skills, about basic life skills. The importance of resilience, the importance of facing failure, of realizing that an exam is only an exam. It need not be. You can always take a second exam. You can always take another chance. And that there is no one thing in life for which you should feel a complete sense of desolation and so on. And along with this, gender sensitization, teaching them to respect themselves, to respect each other. These are all very valuable lessons which can be imparted using these learning centers and creating, I think eventually we hope to develop these into small little young people's clubs where there can be local, built around the library, rural library, so that there can be a weekly meetup, a weekly activity, maybe a match, a football match or a cricket game, a game of cricket, something wholesome, some little physical activity and some social interaction. so that itself gives them feelings of resilience and the skills of interacting with each other, especially boys and girls interacting in healthy and wholesome ways. I think these can all be promoted uh, through this education task force and using the help of local organizations.
Great. So one question is around addressing the mental health concerns, issues, problems faced by frontline workers of any kind themselves. Especially during the pandemic, because they've faced additional workload. They might have done community level surveying. Sometimes they might have concerns about probably not having adequate personal protective equipment. There is stigma issues. There is fear from communities, concerns of their own family members. So what can be done for the mental health support of these kinds of workers?
Yeah, so there is already a program in Karnataka for counseling, both at the state level, tele-counseling, and at the district level. Outbound calls are made to frontline workers to assess how they're doing, to ask them, to talk to them. I'm happy to say that Karnataka's use of technology for these calls has been very good. My own personal experience was that after being diagnosed COVID positive, I got calls too. I got a couple of follow-up calls to ask how I was doing and whether I was feeling any, stress or anxiety. They said, "Don't worry." I thought that was really good, because it was actually, they were not doing a perfunctory call, just ticking a box. They were actually telling me, and I actually felt that that was something where our use of technology has helped. Similarly, we are trying to support frontline workers with, not only during COVID, but even before and hopefully after. Karnataka has been progressive about using whatever resources can be managed to help frontline workers in their task, which is this during COVID, especially an important source of stress was the matter of insurance in case something happens, and that health insurance, covers all frontline workers. That was one of the first things that our state did. Um, it's again, it's something where, again, at state level, at district level, you have 40,000 ASHA workers. You have 66,000 Anganwadi workers. So you can take up a uniform policy. You can set up a uniform kind of a outbound call system or a tele-counseling system. But again, this is something where local governments can play a part in providing local customized support. There are certain kinds of difficulties which the state government or the district administration may find it difficult, or it may not even come to their notice simply because it's localized. But local governments can again play a part. And I think this is again an area where I certainly plan, once I join back at work next week, I certainly plan to take this forward on an area of focus to be given to local governments.
Great. So as I mentioned, maybe in my introductory remarks, the theme for World Mental Health Day this year, tomorrow, is greater investment and greater access. And so one of the questions in the chat window is about the fact that to enable the treatment access and rehabilitations of persons living with mental illness, you require care to be available. And we know that there is a shortage of mental health professionals, especially in rural areas. So how do you fill that treatment gap? And is there a role for frontline workers? And if yes, in which way?
Yes. So I had a word with the Deputy Director of the State Mental Health Program yesterday to discuss what the state has been doing. ASHA workers and Anganwadi workers are already provided some training. I think it's a day's training. I would say that going forward, especially because we're going to face challenges, not only during COVID, but post-COVID, and we already are seeing, there will be impacts on livelihoods. We're not done with challenges, and we need to prepare for those. And the more decentralized it is, the better, because care will be locally available. And it will also be, the kind of first line counseling which can be provided, which can really protect a lot of people and prevent situations from becoming far worse. So I would say that maybe we can think of extending the training with frontline workers. We've got 40, as I said, 40,000 ASHAs, 66,000 Anganwadi workers. That itself is more than 1 lakh workers. ANMs, Anganwadi supervisors, 2,000 Anganwadi supervisors. The supervisors they can be trained in far more detail because they are qualified. They come with child development specialization, sociology specialization. So they have, I think, the potential to be trained in far more greater detail and become resource persons for further training of retraining of frontline workers. We also, as I said, have around 1,95,000 or so elected representatives who will come into position once the elections are held. And elected representatives also can be given, of course, not training, but an orientation into the different ways in which they can address mental health at the front lines. I think all of that together can play a big role in helping people and communities become more resilient and facing the challenges that are to come.
Okay, so one of the questions is whether frontline workers can also involve families and panchayat members, especially the influential ones, in addressing mental health care needs at the family level. For example, if there is an individual with the mental illness, then helping them realize that there is a provision to access care, enabling that, sensitizing, maybe providing some of that information to the local health officials, to the local subcenter or the PHC. In a way which is non-stigmatizing and also doesn't violate privacy. So being supportive
Yes.
and not necessarily intrusive.
Absolutely. Absolutely. That is precisely what I meant by convergence. That on the ground, when there is a situation where somebody requires care, somebody requires treatment or a referral or an admission for some kind of treatment, it's the community which needs to convince the family that this is in the best interests of the individual. It's also in the best interest of the family, and to care for the family. Suppose it's the breadwinner, suppose the only breadwinner, then somebody has to care for the family. And if the family doesn't have anybody else, it has to be the community, and the panchayat has to play this role. And I really feel that many districts in Karnataka, the panchayats are not just in districts. I think in every district in Karnataka, in this thing, many panchayats are well placed and well positioned to play this role, because these are community leaders and their voice is respected. And we should use that for progressive and good and sound reasons, and for bringing and just the very fact of panchayat leaders coming and talking families through this difficult decision at a time, and expressing support itself will go a long way in reducing stigma. So by all means, I think that's a very important measure that we should promote.
Okay, so there is a question which might be not related to today's topic, but is probably a question around good leadership practices, and that's related to how does one prioritize? So how do you prioritize? There are multiple things, I'm sure, which pull you in various directions. So as a policymaker who needs to get the work done and also wants to keep your ear to the ground, how do you prioritize on a daily basis, a monthly basis, etc.? And the second thing, how do you enable your colleagues, to be productive, especially if some of them might be unstructured and you have concerns? How do you work with them in ensuring that they actually can become more productive colleagues?
Okay, so I'll answer the second question first. I allow people to be productive by just allowing them to be. I let them work. I give them a very long rope and encourage them to take initiatives. I tolerate mistakes. I help them understand mistakes and work them through and see how we can address and do things better. And that, I think, really brings out a lot of good work. It's also good, I think, in teams to, because if you don't care who gets the credit, you can get a lot done. And therefore, that's a lesson I learned long back. It really doesn't matter who gets the credit. Credit is the least important of any of the work one is doing, because what you really want is to get work done. And if you encourage people to step forward and support them through it, they will do wonders. Whether it's field functionaries, frontline workers, or people who work very closely under my immediate supervision, that's always been something I've found, that appreciation and giving people the freedom to work brings out the best in them, brings out their imaginative, innovative practices, and showing them that there's no need to fear failure. They don't need to be afraid of failing, because I'm there to back them up, and we can work things out and rectify things together. How I prioritize, actually, that's one of the challenges, and it's also one of the exciting things about this work, that there are so many priorities that you always want to do everything at once. And I tend to get into things very much in detail. But it's also true that for any policymaker, anybody working in government, your priorities are not your only priorities. There are also the priorities of those who are senior to you. There are priorities which may to you not seem the most important, but you need to, as a responsible leader, ensure that all priorities are kind of, you need to juggle many balls, and you need to try and see that you don't drop any of them. It's it's something that you learn to do, taking every day as it comes. Sometimes you do it just in time. Sometimes you get a little more time to breathe, and you get a little more time to plan and put things at the back of your mind. But I can just say that it's one of the most exciting parts of the job, having a lot of things to do, and having the space and ability to do some of them in some small ways.
All right, so we're slightly over time, but I think, the last set of questions which we ask all our speakers to maybe ponder on and let us know is how do researchers, work with policymakers like yourself? What is the kind of research you would like to be seeing which would help you make decisions? And once researchers finish their projects, etc., how can they actually communicate effectively for advocacy purposes, and how can they get their research findings to you in a way they could initiate policy change as applicable?
Right. That's actually a great question. Research reaching policymakers is one of the biggest challenges, and it has tremendous benefits when it happens on the rare occasions when it actually happens I love research, so I'm not the typical person to answer this question. So I'll give you my personal answer, and then I'll give you the answer as a typical policymaker. So my personal answer is that I love reading research. I love reading research findings. So I have and I have a great desire for context. So if I read one paper, I won't just read that one thing. I'll go back and give a search and try to understand what is the context of this subject. What are the different kinds of learnings that have happened? What does it build on? Where can it lead to? So on and so forth. What are the kinds of interventions that could be made possible through this, and so on. And I love nuance. But both of which are not really, they are luxuries for a policymaker, because as I said, you're juggling so many balls, and you're always, busy so much of the time with a lot of stuff, not all of which maybe maybe necessarily productive, but it's important, and some of it may be ceremonial, some of it may be all kinds of things, but you're always busy. And therefore, research to reach policymakers, and sometimes even I have faced this, it needs to really, while nuance is important, it needs to come in very crisp, the findings need to come in very crisp bullet points, as it were, so that you know that given this, you can do this, right? So you should also caution, because bullet points can sometimes be stripped of all context and nuance. And therefore, you should also caution, researchers should also caution about what is the context in which this can be posited to work. or this could be a learning, or this could be a suggested way forward. So that is one thing. One has to realize that administrators are not really people who who always are not punctual, or so on and so forth. Sometimes it's just that our time is not our own, and therefore policymakers need very crisp, very clear information about what works, where it works, how it works, under what circumstances, and where it cannot be extrapolated into. That is one part of it. The second part of it is that to forge such collaborations, it's extremely important. Twitter, for example, is a great medium, because I follow a lot of public health experts on Twitter, because I've been reading more and more about COVID. I want to know more about it, want to know about measures in public health that will help me to do my job better. I think it's important for us to focus on action research and to look at what we can do, because we're always, our time, neither is our time our own on a day-to-day basis, nor are we in a posting forever. But we'd like to create some impact or build some momentum within the year or couple of years that we have in a particular posting. And therefore, while I love, long-term research and blue sky research and all of that, I love all of it, and I think that's fabulous, and there's a place for that. I think action research is also important to help us do our work better, because ultimately the work is important. The work of changing people's lives, improving people's lives, is very important. And the more one can do, the more satisfying it is. And those, I think, are the best collaborations. If we can forge such collaborations, we can really achieve a great deal. That's the kind of collaboration that every policymaker really dreams of building.
Thank you so much. So we are out of time, but thank you so much for being so thoughtful, and for sharing your perspectives, your experiences, and also giving us insights around how do you think the whole agenda around mental health access, treatment can be enhanced. How we can take these conversations forward. What is the role of local peer groups, local self-government, Panchayat Raj institutions, etc., in promoting, and what are some of the takeaways with actually the kind of experiments which have happened. You provided some very positive examples of how things have changed on the ground, and I think that's great, because I think that will also give a lot of the young researchers who have joined us today some ideas around the future directions perhaps of the kind of mental health work we need to see at the community level, and also actually any kind of public health work for that matter. So very, very insightful to hear from you. Thank you so much for joining. I know, these days are busy for all policymakers, but you did carve out more than 90 minutes for us, and we are very thankful for that. Thank you everyone also for joining us. This series will continue, so please keep a watch out for emails as we announce future policymaker engagements. All of those who registered will receive follow-up emails when we schedule another webinar. All of these webinars are also available on our YouTube channel and on our Sangat Facebook page. But please do join me in once again thanking Uma for joining us today, and for sharing all her experience and thoughts with us on this wonderful topic. Those of you who require an e-certificate, please reach out to Babita at babita.negi@sangat.in. And thank you and take care. Have a good weekend, everyone. Bye for now.
Thank you. Thank you, Anand. Thank you very much.
Bye-bye.